Welcome to Elixium Podcast, where health is personal, meaningful, and lasting. We go beyond quick fixes to uncover the root causes of how you feel so you can take control of your health and your future. So hospitalist.
Yeah.
What is that?
Years. So a hospitalist is a doc that works inside the hospital and rounds on patients and is like their primary care doctor inside the hospital. So if you get admitted for like a GI bleed, a heart attack, a stroke, pneumonia, you have a primary doctor when you're in the hospital. And that used to be your local community doctor. So it used to be the doctor that you saw as an outpatient in a clinic. They would also do rounds in the hospital, which was crazy for primary care doctors. They would spend their mornings at the hospital and then they would go to their clinic and have a full day of clinic. And then after they finish their full day of clinic, they go back to the hospital to round on patients again. So over time, what's actually happened is that primary care doctors just stay in their clinic. And then this other field about 30 years ago now started is called hospitalist medicine, maybe even longer, maybe about 40 years ago, like late 1990s. It started off like just specializing in hospitalized patient care. And so when I went through medical school, I did my internal medicine residency, and it was the first job basically that I had was working in the hospital, because when you're actually in training, you do most of your work in the hospital. So you're very comfortable with that kind of work. Yeah. And so it's very easy for me to transition from being a medical student to being in residency to being a hospital doctor. And I did it, full time for almost 15 years.
Wow.
I retired in May of this year. Was my final.
Oh, really?
My final shifts. Yeah. It was a slow wean. It wasn't like I went from working 17 or 18 shifts a month, which I was doing for a long time, down to 0. It was like 17 for many years, then to 10, and then to 5. Then it was like, even on those 5 days, I can't spend the time because I have so many other things going on. And then it started to get a little unsafe. I felt like, because there's a certain amount of, like when you're in the hospital, you're doing things like, it's just like, there's a certain amount of exposure you need to remind yourself how to do certain things. And so when you get down to a certain amount, and I remember seeing this from other people that had actually decreased their hours over the time when I was still working full time. And I was like, this person shouldn't be working anymore. Because like you get to be unsafe. Yeah. And so I had a couple, like one like close call. It was, thankfully the person was fine. I'm like, you know what? I got to stop. So but it was a big moment for me, so many years doing it. Yeah. And I've always enjoyed things outside the hospital much more than being in there. But, I got married relatively young at 29, and then I had started having kids, and I have 4, and then my wife was in fellowship and she's also a physician. So, it was one of those things where it's like, there was never like a burn the ships moment. I remember going to like a conference with a Tony Robbins conference in 2016. He's like in 2016. And he's like, you got to burn the ships. I'm like, yeah, but no, like a lot of us can't do that. Right. Yeah. And can't just like the burn the ships analogy for people that are listening is you just have to, the idea is like you're stranded on a desert island and you have ships, right? And then you burn the ships and you just got to figure it out. Right. Yeah. And I really do. I do have a lot of respect for people that can do that, but that was not something that really was programmed in my DNA to do. So
no, that's fair.
The slow wean, man.
That's fair. Yeah, I was actually, ironically, I was listening to a podcast this morning, and that was the topic, is burning the ships. So it's funny you brought that up.
Yeah, it's an interesting topic.
Yeah, because that's pretty much what I did when I started Elixium, because Elixium is like our 4th try at doing like health optimization clinics. Okay. Well.
Number 4. Okay.
It's number 4. Yeah.
Lucky number 4.
Yeah. You'd think they always say 3rd time's a charm, and I'm like, 4th maybe, because the 3rd was not. But either way, like I had always had like secondary or tertiary things that I was doing at the time that we were trying to like grow this business. And going into Elixium, I was like, all right, if I'm going to do this, like I'm doing this. Yeah. Like there is no plan B. Like we were going, and if we fail, then we fail. But ultimately, like this is it. Like we're committing to this. Yeah. So I took that to heart, actually. I went the opposite way.
I can understand that as well. I mean, you've tried it in different ways, right? Yeah. And it hasn't worked, right? So it's like the definition of insanity, trying to do the same thing over and expecting a different result. So I feel you there. And actually, what happened for me is that I always knew that hospitalist medicine wasn't for me. Sure. So then I started throwing the proverbial shit at the wall and seeing what stuck. And then all of a sudden it's like, holy shit, I have so much stuck on the wall. Right. And so now over the years, I've culled it down, but I'm still, busier than I'd like to be sometimes. But I also know this is the sort of the evolution that I've kind of created, right?
Sure.
So one thing that you always have to remember is that if you send an email, you're going to get an email in response, right? So like if you're starting to communicate and really do a lot, you get a lot more inbound, the more outbound you throw out there. So that's kind of been the evolution there for me. As I stopped working in the hospital, my capacity has gone up, but also the inbound that I get as a result of that has gone up dramatically. So it's been fun. Like I love what I do, but it's every day is like, okay, prioritize, Scott. You can do this.
Yeah,
so,
absolutely. Absolutely.
I'm sure you feel the same way.
Yeah. I mean, luckily mine's one business, and you have what, 3, 4 different businesses?
I mean, so like I have a couple. I have my main thing, even though it's not the majority of what I do, is my clinical practice.
Okay.
So I still have a telemedicine clinical practice. I do concierge consulting. The framework is called Health Optimization Medicine. And it's based on a nonprofit that we started in 2017.
Yeah, Home Hope.
Yeah.
Is that right?
Yeah, exactly. Yeah. Homehope.org is the website. And it was started by a guy named Dr. Ted Achacoso, who's the founder of it. And it's a 7-module certification course for practitioners that are looking to really change the perspective from optimizing just for disease and illness and really for optimizing for health instead.
Interesting.
Optimizing biomarkers between like when you're 21 to 30 years of age. Yeah. Thinking about it more from a cellular perspective rather than like an organ perspective.
Right.
And so I've done that for the last, 5 or 6 years now. And because that's my primary clinical practice. And then I also do some hyperbaric oxygen therapy consulting as part of that, because I've been involved in that field for a long time, over a decade. So that's my clinical piece. And then that takes some of my time. And then I have a company called Troscriptions that makes a lot of products that help people right now along the path of optimizing health. And we have things with methylene blue and other kind of cool ingredients.
Which you guys just hit the Inc. 5000, right?
We did, yeah.
Yeah.
Yeah, we got the,
thank you. That's huge.
Yeah, the Inc. 5000 this year. Yeah, we were a very fast growing year. It's been a very exciting year. A lot of interest in methylene blue has kind of kicked it off.
Okay.
So the Troscriptions company I spend a ton of time on. That's kind of like my primary baby at this point. And then I have a hyperbaric company that sort of evolved into more of a technology in-home connected systems technology company called One Base Health. Okay. And that company is run by some really cool people that I help advise, and I also consult and do some chief medical officer kinds of things for them. Yeah. And so that's like super cool. That's kind of more focused on the integration of various technologies together and how you can use that technology in more of an ecosystem to help you, reach your goals. Interesting. With a bidirectional flow of information from the technology itself to your wearables and things like that, and your goals and things like.
Interesting.
Yeah.
Okay.
So that's a lot. It feels like a lot. I also have 4 kids and I'm married, and there's all that too, right? So it ends up being a lot on a day-to-day basis.
Yeah.
But
no kidding.
But prioritizing is still my day-to-day.
Yeah.
My day-to-day. That's what I try to do on a day-to-day basis. Like, what do I need to do now?
Yeah.
What are like long-term goals? Always those in the past, like they're in the sort of on the high, around me, so I know what those are. But
yeah. It's just staying present.
Yeah.
For sure. Yeah, there's a lot there to unpack for sure. I definitely want to talk to you about Home Hope.
Yeah.
For sure. Because that seemed super interesting. So essentially, do you guys like partner with clinics, or is it with providers specifically, or is it kind of both? And then like, what's unique about that approach versus like, all right, I'm going to go through A4M and I'm going to get certified through there.
Right. So the perspective shift is really important, right? So that most times we talk about health optimization, it's typically not in the context of really trying to optimize these meat suits that we wear for when we were 21 to 30 years of age. That's when we were the most optimized to do everything that you can remember. Resilience is big. Your ability to go on less sleep, you bounce back faster, fight, fornicate, all those kinds of things, right? Mm-hmm. And so the goal with health optimization medicine in practice is to reverse your biomarkers, your vitamins, minerals, nutrients, hormones, everything to when you were between 21 and 30 years of age.
Sure.
And so the goal is also to take disease out of the conversation.
Yeah, take it
Everybody
out of the
has those kinds of symptoms and diseases. We all have something, right?
Mm-hmm.
But if you focus on foundational things primarily, everything else gets easier to address, or those things kind of go away on their own. And so, most of these practices like A4M and others, they're focused really on organs specifically, like integrative cardiology or integrative pulmonology or whatever, like neurology, like, and it's cool. Like it's so much better than just conventional bad day care. So I agree that it's a significant improvement. But what's different there for us is that instead of being organ specific, we're cellular specific, right? And so there's a word that we like to use. We actually have shirts that say this on them called holobiont hacking. And the holobiont is a cool term. It's like, think about you're an individual in a population, in a community, and like you live in an ecosystem. We live in Boulder, you live in Arvada, whatever, right? But within within these meat suits that we live in, we have tons of bacteria, fungus, and virus. We're getting lights, we're getting water, we're getting food, we're getting toxins, pollutants. So we can actually measure all of these inputs, what's happening outside the body and also what's happening inside the body on a level that's called your metabolomics. Metabolomics is the study of these small molecules that make up your capacity to run your system in real time. So it kind of tells you what's happening right now in the body. And so we test metabolomics using this framework, and the holobiont is the whole ecosystem that we're testing using metabolomics. And so that's all these inputs that are coming from outside the body, everything that's coming inside. And then, we know that we are vastly outnumbered as far as cellular between, bacteria, fungus, and virus that are in us or around us versus human cells. Mm-hmm. We're vastly outnumbered at all times. Mm-hmm. So the question always becomes who's running who kind of thing, right? So they vastly outnumber us. Like we have our microbiota itself is like 10 pounds. Yeah. So if you go and you have like a bad diarrheal illness and you lose 10 pounds, you lost 10 pounds of microbiota, right? Yeah. You're going to gain all that back, but like it's its own organ system, and it's communicating with all the rest of your cells in your body. It's communicating with the part of your cell that's called your mitochondria to help, like, do you make more energy? Do you make less energy? Like it's called interkingdom crosstalk. Like you have all these different types of bacteria, fungus, and virus that are talking to your cells. And it's like, it's all kind of happening. And so what you really want to do from our perspective is you want to optimize at that foundational level, and then everything else gets easier. So that foundational level is your metabolomics, looking at it from a holobiont perspective. And then looking at your diet, your lifestyle, your stress, your relationships, your entire sort of thing that's causing you to either be healthy or to not be healthy. And just because you're not sick doesn't mean you're healthy. It just means you're not sick.
Sure.
I know we talk about that all the time. That's one of Dr. Ted's lines. And so just because you feel well doesn't mean that you're not getting crushed cellularly. And I've seen this time and time again over the years. I mean, the good example here would be somebody that got COVID, right, during COVID, and they were fine beforehand. And now 3 years later, they're still dealing with long COVID symptoms.
Yep.
This is almost always because they had something underlying that they weren't addressing ahead of time, like a leaky gut or leaky brain or poor energy production, mitochondrial dysfunction. It could be any number of things, or just severe stress or something. And then they had long COVID. They had COVID, and they had a severe inflammatory response, mm-hmm. and their body just couldn't recover.
Sure.
Right. So it's not just about feeling well; it's about being optimized. And the shift is what's big there. Most labs, for example, you go to like a lab company, most laboratory values, if you go to like a lab company, they'll give you a normal range mm-hmm. between 18 and 64. Mm-hmm. So that's okay, maybe, but like, do you really want to be optimized for like being 45 years of age, like I am, or do you want to be optimized between 21 and 30? So if you go and look at the lab test and says it's normal, what does that even mean, right? Sure. And some labs, some hormones specifically, like a TSH is normalized between, I think, like 9 and 93. So like there's a huge range in there. So like you don't want to have a 93-year-old's TSH. You want to have something optimal, right? Yeah. And so that's a big thing. If you go to like a regular lab and they say you have normal, you don't feel good. That could be because it's not normal. Really, it's just it could be normal, but it's not optimal.
Yeah.
That's the difference.
Yeah. Interesting. So you guys don't test like the normal stuff. Essentially, like you guys don't test based on organ function. Like you don't go in and test a thyroid panel or a CMP or a testosterone hormone panel. Like that's not necessarily the focus up front.
Well, think about it this way. Like when you go to like your primary care doctor, they're looking for diseases.
100%.
Right. And so they do your basic laboratory panels to look for kidney dysfunction, liver dysfunction. When it comes to hormones, if you go to your regular doctor, they might check your thyroid, they might check your testosterone and say, oh, your thyroid is normal. Your TSH is 4, right? That's normal, right? a normal range, but that's not normal for somebody that's
No.
30 years of age,
Absolutely not.
or for even somebody that's 45. They shouldn't have a TSH of 4, right? Or your testosterone level is normal, but it's 500,
Exactly.
right? And like you feel like shit.
Mhm.
And so the goal would be for us is like the basic stuff, like basic labs need to be done for everybody at their normal, regular screening schedule. So if you're 30 years of age, you should probably get labs done every couple of years, maybe
Sure.
every 3 years, just basic stuff done.
Yep.
But when it comes to hormones or looking at vitamins, minerals, nutrients, and cofactors, it's about testing the whole network, not just your B12 and folate, but like all of your B vitamins, not just your testosterone and your thyroid, but all of your hormones, right?
Mhm.
Your testosterone, your thyroid, your prolactin, your progesterone, your growth hormone levels, your adrenals, your cortisol, your insulin, like, because if you do all of those things, then you can look at them as a network. The problem is if you just work on somebody's testosterone as an anabolic hormone, you're going to mess up catabolic hormones like TSH sometimes, like in your thyroid, right? These things have anabolic catabolic pairs. And so what I mean by that, anabolic ones are like the ones that build you up,
Mhm.
like your testosterone, your growth hormone, your insulin. And you have your catabolic hormones that that kind of break the system down.
Yep.
And your body's always in a balance between these two, right? So your thyroid, for example, is a catabolic hormone. It's something that increases your metabolism, so you break things down. So there's these balancing acts that our body's always doing.
Yeah.
And then if you move one node in the network without moving all of them,
Sure.
you're going to find yourself in trouble. And so when you're looking at testosterone replacement as a good example, right? Like you don't want to just look at testosterone on its own. Typically, you want to look at all of your sex hormones and all of your pituitary hormones as well, because when you move your testosterone level, you're also going to move others at the same time, because everything's kind of working on feedback loops to be able to try to balance the system. So if you imbalance it by shooting your testosterone up to 2000, that's also going to imbalance other hormones at the same time,
Mhm.
even if you feel like Superman, right? And so that the key with us is to look at things more as a full network, looking at the metabolites of these from a cellular perspective when it comes to nutrients. When it comes to hormones, you look at all of the hormones, not just a couple, and you balance to a network of all of them together between that 21 and 30 years of age optimal range.
Understood.
Yeah.
Okay.
Yeah.
And metabolites, when you say metabolites, I think of micronutrients. Would
Yeah,
that be
that's
right?
one of them. Yeah.
Okay.
So the best way to think about this is like an organic acid test.
Okay. Yeah.
So like an OAT test would be looking at metabolites. You have metabolites of B vitamins. You have metabolites of fatty acids. You have metabolites of gut microbiota, metabolites of mitochondrial function. So you can see all the various ways the cells work.
Yeah.
And it's probably the best way we have right now to look at cellular function in real time. And so there's new tests coming out for mitochondrial function, which are interesting. Clinically, my colleagues and I are not convinced they're perfect yet to really be able to like hang your hat on. There's epigenetic testing and there's others, but like in essence, metabolomics has been around as a science for over 25 years now, but it's only just starting to get into clinical practice. And the reason why it takes a long time is because it's not simple. Like I learned how to understand mitochondrial function when I was in medical school, but as soon as I learned it, I forgot it so that I can learn the new thing.
Sure.
Right. I remember when I just finished my anatomy test and I was just studying so hard for it. And this is when we had to go to ATMs to get money, like when we used to get money from ATM. I remember the last time I did this, but when I was a kid, this is what you did. And I went to go in to put in my PIN, my keypad, my PIN, and I had no idea what it was. It was gone. Like my brain had just like lost it.
Got rid
like
of
it was like, because I was cramming so much information in there. And like
Yeah.
in medical school, you cram so much in and then you got to throw it all out.
Yep.
So you get the next
in order
stuff
to make
in.
room for everything else.
It feels like it, you know, like your
That's so
capacity is pretty impressive if you put your mind to it. But in essence, like that's what you do in medical school. You just learn the material. You don't understand the applications of it.
Sure.
Right. And so now I know all the applications of mitochondrial medicine, cellular medicine. And I also know like how poor mitochondrial function is overall for most of US adults. And so then it's this whole process of optimizing mitochondrial function that takes time, right? And that's where we have things like methylene blue that have become so popular this year that have given us this additional way to improve mitochondrial function very quickly, for example.
Sure. Before we get into methylene blue, what lab do you use for the metabolites?
So I use Genova Diagnostics.
Do you?
Yeah, Genova is the best.
Uses Genova.
Genova is the best because they have the best ranges.
Okay.
They have the ranges between that 20 and 30 years of age. I've called other labs. I've asked them if they could piece out the data. Most of them won't do it, you know? And so with hormones, it doesn't so much matter. You can go to LabCorp Quest because you just want to get the raw numbers and then you can go through various matrix. There's a couple different people out there. There's a guy named Mark Gordon who does a lot of hormone work for traumatic brain injury, but also very good ranges. I like his ranges. There's also a guy named Thierry Hertog, who's a hormone expert from Europe, and he has a couple books. He's a book called The Hormone Handbook. It's like a 500-page book. And he's probably the most aggressive when it comes to hormones.
Yeah.
And then Dr. Ted, who I work with, has got his own ranges that we've developed over the years. And so I use those, which are very similar to Dr. Gordon's ranges just about. And so the key is just, you want to be in the middle of the range between 21 and 30 years of age, right? And so if you're a male, your testosterone starts dropping at 30, right? If you're female, your hormones start declining around the age of 35 or so. And so this is when you have a baby. If you're over 35 as a female, you're called AMA, you're called advanced maternal age because of that, right? And so, with males, it's this, andropause thing, right? So like your hormones start slowly dropping. You don't realize it until like you go like, why do I feel so terrible? And then you go, oh, well, it's because of all these hormones, right? So, and then, and there's probably other things as well, like, but that's a big part of it. With women, it's usually much more of a cliff because of menopause, although it's, with women, menopause or menopausal symptoms can start age about 35 or so. And then they can, but every woman's a little bit different. But, hormone shifts are happening during those ranges. So
absolutely.
The key always though with hormones, and people are just, I have like a healthy respect, and I think hormones can be really great. But if you don't nutrient, gut, and sort of health optimize, otherwise, like they're kind of just like Band-Aids. Like it's like go to the doctor and getting a high blood pressure prescription without changing your diet and losing 20 pounds.
Exactly.
Right. So like it's all in the context for me. But I get it, right? People need help right now in various ways, and hormones can be helpful in that case. But it's just like some of these GLP-1s. It's the same kind of deal. Like it can be a good way to get started, but it may not be the thing you want, especially if you're not doing the additional work of like, oh, maybe I need to train my body to not think of food the same way, that kind of thing. So
definitely more psychological. I mean, we used to be a hormone clinic. Like that's what we used to be. Back in the day when we first started, it was male testosterone. Like that was the key.
Makes everybody feel better. Testosterone.
Oddly enough, like we used to say, your primary care is putting Band-Aids on things. Meanwhile, we're fixing things. And then looking back, I'm like, that's the most ridiculous thing, because we're still putting Band-Aids on things by doing hormone optimization. So we've gotten a lot more into the gut. But from like a metabolite or micronutrient standpoint, it's always so expensive to run an additional. It's like, hey, we need to do obviously the baseline labs, which are going to cost X. We need to do a gut panel, which is going to cost X. And then I need to test your micronutrients, which is going to cost an additional, because no one runs it all, because they're all different modalities or ways of doing it. So that's always been my problem, is I'm like, I don't want to throw a $1,500, hey, this is what it takes to start with us.
I totally understand. And then you have to think about what's sexy and unsexy, right? Because the hormones are sexy. Hormones are going to make you feel good almost immediately. Whereas almost always the nutrient gut metabolite optimization, it takes longer. It takes 6 months or a year. And like, what are you going to do during that time? Like, and then so what I always typically recommend for people is to start off with that, but then find things that can help them right now feel better while they're on that path. And then what I always tell my clients that I work with, I tell them, let's wait at least 3 or 6 months before we check your hormones, and then we'll check your hormones, and then we'll optimize them. But if you didn't nutrient and gut optimize first, it's like pissing in the ocean. Like you're not going to be able to see long-term benefits, and then we might be able to get you down significantly on the amount of hormones that you need. I mean, as a male, if you're over 45 or 50, there's high likelihood you're going to need some testosterone support. Does it mean that you need to take testosterone? No. Could you take other things that support testosterone? Yes, of course. But you might need significantly less of that if you clean up your diet and optimize your gut. And so I do a lot of metabolite testing in the urine and the blood, but also, like, as you mentioned, gut testing is huge, right? Because if you don't look at the poop, you don't know what's going on. And so I've had tons of people, just shocked to me, like they've been through like 10 doctors and like, all these things, and they've never had a stool test done that looks at all the markers that you can see, from digestive capacity to malabsorption to gut microbiome overgrowth or pathogenic bacteria or leaky gut and things like that. And then once you start doing that, then you can see a big shift in people real quick. And this is actually one way you can actually use hormones. So you can use like growth hormone peptides, for example. It's not as good as growth hormone directly, but growth hormone peptides can seal up the gut within about 30 days. And that can make people feel so much better. And then you can really optimize them when their gut's all sealed up, as you do it. So that's kind of Dr. Ted, who I work with. He talks about the growth hormone fix, which is about 30 days of 1 IU of growth hormone daily for 30 days. And that will seal up almost anybody's gut. But not that easy to get growth hormone.
No, it's definitely not.
Yeah.
So do you guys typically, from a peptide standpoint, do you use like a CJC ipamorelin, or is it an ipamorelin just by itself?
It would be the CJC and ipamorelin, but it's not going to be as good as the growth hormone itself. But the other option, if you're young, if you're about 30 years of age, maybe 35, you can do high dose glutamine as well. So glutamine is your primary fuel of your small intestine. And so most people that have leaky guts are requiring a lot more glutamine than they're getting in. So glutamine is an amino acid. It converts into the brain to something called glutamate, which is a neurotransmitter, excitatory. Then glutamate gets converted into GABA, which is our relaxing neurotransmitter, calms the brain down. And so I did a podcast, maybe, 6 months or a year ago on glutamine specifically. It just blew up. I was just shocked at how many people reached out to me. They said, I just started glutamine for a month and like my entire capacity has changed. Like my brain is better. I'm less depressed. Like my memory is better. My mood is better. And so it's because so many people are walking around with just so much gut inflammation and the gut needs more glutamine to heal itself. And so like one of the primary things I put almost everybody on when I first see them and they have gut issues is glutamine, because that's the one thing that's going to help them almost immediately in a lot of cases. So, but again, I like to be as personalized as I can.
Sure. But there are standard things, I'm sure, that can be done and can help optimize.
Yeah, there are standard things for sure. And then when you're what I typically like to do, if I can, is get somebody on is get somebody tested with everything and then get them empirically on something after they're tested, and then know exactly how to dial it in once we get the testing back.
Sure.
Then I'll start them on things like, things that work on the GABA system, or things like magnesium and B6 or B vitamins. It's like basic things that I know that are going to help. And then things that are going to help right now, things again, like methylene blue, which we can talk about later or whatever, but like things that I know that are going to help now while, they're on that, longer path, and then revisit over time and how we can personalize that plan for them.
Yeah. That's super interesting. Okay. I definitely want to still talk to you off podcast about the home hope, because that's super intriguing for me. And our providers. Yeah,
having a framework has been really like transformative for me. Because I was in the backstory here is that I got involved in hyperbaric medicine, hyperbaric oxygen therapy over a decade, 2012 timeframe. And it's a fantastic technology. I think it's a great healing modality, accelerates healing, it decreases inflammation, great for longevity, I think, and health span and angiogenesis, new blood vessels and stem cells and all these things. But what I found out pretty early on is that if people were pretty sick and they went into a chamber, they would get worse. And I tried to figure out why. And I realized, well, they're just sick, and then hyperbaric therapy itself is causing a stress in the system, right? And then I realized, okay, I need to like really work on these people's health and optimize their health before they get into a chamber. And didn't know exactly how I wanted to do that. I thought about maybe going into functional medicine for a little while. But then I realized, then I met Dr. Ted, and when I met him, he said something very similar, very simple to me, was basically that what I was doing in hyperbaric chamber was just changing what's called their redox potential, somebody's ability to make energy and detox from it. And when I realized that was the case, I was like, I need to be testing mitochondrial function, right? And so what I did was start testing people using this framework and understanding that, this is why. Like if I optimize their mitochondrial function, their ability to make energy, their ability to detox, they do so much better in a hyperbaric chamber. And then they would not have that sort of down for the count kind of thing that I saw happening when people were pretty sick. This got me in trouble. It does get me in trouble in the hyperbaric community because, if you have a technology, you want everybody to use it. And so I was going to give a talk during the pandemic, and the title of my talk was, "Please don't put them in a chamber." And I got disinvited because of that. But my emphasis was maybe we should wait 3 or 6 months, optimize this metabolomic level as I've been describing, their vitamins, minerals, nutrients, detoxification pathways, really their mitochondria in the end, right? And because once I do that with patients, it is like night and day. And what I'll often say is that if you're pretty sick, don't use hyperbaric therapy until you're about 60 or 70% better.
Interesting.
Because then you're going to really potentially benefit from it,
Yeah.
not only in the short term, but in the long term too. So it's a framework that I use that I think is very robust.
Yeah.
And it's not that complicated when you learn it.
Okay.
And it's the matter of just, the nuances of working with individuals over time and
Absolutely
figuring that out. So.
Okay. You brought up an interesting point. So we've been getting to the gut section of what we provide for, we've been working on this for like 8 months. And through that, we've, gone through courses, or our providers have gone through courses. We've gone through A4M. We've done our own research. We've talked to specialists, within that area. And everyone is saying, hey, you need to fix the liver and ensure that the liver is functioning properly prior to putting someone on a gut regimen, because it's going to have to filter out through the liver. Whatever issues are going on will have to filter out through the liver. But it seems like what you're saying is more the mitochondria play more of an important role in the detoxification when it comes to, okay, if you're going to fix anything like the gut, because most people have terrible guts,
right.
Like they're awful. So the minute you get them on a protocol, they're going to detox to an extent.
Yeah.
But rather than focusing or hyper focusing on the liver, which I still think should be something that you focus on, mitochondria should probably be an important aspect of that as well.
Yeah. So think about it this way. Do you know where we have the most mitochondria per cell? The liver is on, I think, number 3, number 4.
Probably in the gut.
So the gut has a lot, but actually it's in eggs and sperm. Eggs have the most mitochondria.
I had no idea.
So you think about it this way, right? How much energy it takes to make a baby.
That's
right?
fair. Yeah.
I think you have a couple, right? So
yes,
I have 4, as I said. So, you watch your wife or your partner make a baby. That is a huge amount of energy, right? So, so eggs themselves have the most mitochondria per cell. How are fertility rates going in the United States?
Terrible.
They're terrible, right?
Yes,
I have
awful
people in my network that are going through IVF right now. And then the brain is number 2, most mitochondria per cell. And then if you have mitochondrial deficiency in the brain, you have brain fog, you have concentration problems, you have wired but tired, you have mental health issues, you have irritability, you have mood swings, all those kinds of things. Then your heart and then your liver is next. Okay. So your liver has a huge amount of mitochondria per cell because detoxification takes a lot of energy, right?
Makes sense.
And so I have a friend of mine, his name is Ryan. He likes to say you have to redox before you detox. And what he means by that is exactly what you just said, is that you have to support mitochondrial function to be able to detox effectively. And if you just look at it as like a detox side of things, you're right. You're going to get into trouble because your system needs to get rid of that stuff and you don't have the energy capacity to be able to do it.
Yep.
So when you're optimizing for gut function, you have to optimize mitochondrial function at the same time. And like it becomes like one of these things where the mitochondria are playing a role in almost everything.
Sure.
They are your energy producing part of your cell. They make this thing called, or ATP is what it's called. It's adenosine triphosphate. We make about 150 pounds of it every single day. Pounds. And so, but that gets recycled. We use it all the time. And so if you're energy deficient, you're not making enough of that, you're going to get symptomatic. You're going to get detox issues. You're not going to be able to use the liver to do what you need to do, right?
Yeah.
Or cardiac issues or brain issues or fertility or musculoskeletal issues or gut issues. Like these all go together. And so it's really important to mind your mitochondria. Cellular medicine is really the future, right? And so mitochondrial medicine is a big part of that. So you can use various interventions in the mitochondria to help it right now, but you want to help with that redox potential, the potential for you to be able to make energy effectively. And not only do we make energy, but we're kind of like a gasoline powered car. We make what are called waste products of energy as well. So we make ATP, but we also make carbon dioxide, which is not technically a waste product. We actually need it. It's a signaling molecule. They all are actually at lower doses or lower amounts, or the optimal amounts really. Then you have water. We make water in our cells, and we make what are called reactive oxygen species. Reactive oxygen species are these small reactive or excitable or inflammatory kinds of molecules that at small doses amounts actually signal our mitochondria to either make more energy, stop making more energy, hormone pathways, nitric oxide. This is all being regulated by these free radicals, also called reactive oxygen species. But if you have too many of them, what the body needs to actually neutralize them over time is antioxidants. And if your body is antioxidant deficient, you're going to get a buildup of those oxidative molecules, and the system is going to start getting a lot more inflamed. And then that's when the mitochondria stop working as well. and they start going and setting out distress signals, like we're not working well, we need more energy, help us, and then your stress response goes up, and you kind of like fall into this thing that I call the sympathetic spiral of doom, which is this: your nervous system is overactive in fight or flight, your mitochondria is stressed because of it, or your mitochondria is stressed and cause your sympathetic system to go into fight or flight. You get this like sort of spiral that you have really hard time breaking. So you break it by focusing on mitochondrial function, and you break it additionally by focusing on that sympathetic overdrive, that fight or flight. And if you break it on both ends at the same time, that's when you really see benefit and change very quickly in people. So you can do that short term, you can do that immediately by using various compounds. And then long term, it's optimizing what we've been talking about: vitamins, minerals, nutrients, cofactors, optimizing the gut, optimizing your mitochondria, using all those kinds of tools together. So there's an immediate way, and there's like more of a long-term sustainable way. But the key is to do both.
Yep. Because the immediate way is, I mean, from what I hear is, if I optimize the mitochondria, at least to start, then I can start working on the gut. Then I can start ensuring like the liver is functioning properly, like all of that. But the mitochondria has to be healthy and working,
or at least supported, right?
Supported.
So like you don't have to be. So what I typically tell people is this: it's like, if we can get your mitochondria working just a little bit, a little more energy, a little more detox, you're going to tolerate some of the symptoms, you're going to tolerate some of the supplements that we give you much more easily than if we didn't. So if I give somebody like a high dose of, let's say, I don't know, even an antioxidant, like give something like glutathione, but their mitochondria are just not in a place where they can optimize detoxification yet, it's like the whole system might just crush with the amount of detox that's required, right? So this is where methylene blue comes in, honestly, because like it's something that I can use in very small doses to help people on the energy production side and the detoxification side. So they can start a little more energy, a little more detox, and then I can start getting them on supplement regimens, getting them on a good gut regimen, optimizing their diet, their lifestyle. Yeah. So it's one of the things that I found to be a great way to do it. Hydrogen tends to help people as well. You know, hydrogen inhalation or hydrogen gas, or that's inhalation, or hydrogen tablets sometimes can be really helpful because it does help on both sides as well. So there's a couple of different things that I use, but that's what I'm doing on the mitochondrial side. And then I'm also trying to figure out, well, how can I leverage something called your GABA system, which is the brakes of your brain's neurotransmitter system, to downregulate your sympathetic, your overdrive response, so that you can kind of take the brake, press it down, and then optimize mitochondrial function. And then you can start optimizing the gut. And then you can start doing the harder work of seeing the benefit of the things that you want to see.
Yeah. So there's a lot of prep work.
Yeah. I mean, it's all happening at the same time in various ways, but like I just know that if you try to do too much at once, people won't do very well typically. No. And then as a result of that, they will not continue their path with you. So it's not always a straight road. Like you start off here and you go to use jagged there, and you're kind of gonna, like, everybody's gonna be, I mean, the thing about it is that it's kind of like my high horse for a minute is like, if you listen to advice on Instagram by people who don't see patients for a living, you have to be very careful, right? Because they don't know what they're talking about outside of their own experience, right? And so if this is my sleep stack, and you try your the same sleep stack, and it doesn't work for you, it's not shocking, right? You're not them, right? If you're not, Brian Johnson and spending $3 million a year on optimizing your micros or your macros, and you're eating a vegan diet, I promise you, you're not going to feel well. And I've seen this, a number of times over the years. So this is why personalized advice and working with clinicians is so important, I think.
Absolutely. Let's talk about methylene blue.
Sure.
I don't know if you remember, I talked to you because PJ Sorbo is the one that he's like, hey, you guys should start getting into methylene blue. And I was like, yeah, I mean, I don't even know where to start. I don't really understand it. So on and so forth. He's like, you need to talk to Scott. Scott's your guy. And I'm like, so we talked on Zoom or whatever. And at the time I was looking at it more from like a cognitive perspective. I'm like, all right, like I need the focus. I need that. Like that was my thought process with it, is like, it's going to help people function and focus better.
Yeah.
And I went through the slew of things that I do on a regular basis from stimulants, and you were like, you're not really going to see much from a focus perspective.
Right. I remember actually this conversation, because I remember saying to myself afterwards, like, it's not for him right now.
No. Yeah. And I've actually gotten off of pretty much everything. Coffee's pretty much it at this point. So I did take your advice.
That's great. Great. Thank you. That's good to hear.
Yeah. But from a methylene blue perspective, I think everyone sees it as, or it's being marketed as the the cognitive, like
Yeah.
it'll replace your Adderall. Like that's what I hear a lot is like, hey, I've heard this methylene blue. Could I get off the Adderall or could I stop drinking as many energy drinks or whatever? And I'm like, theoretically, I guess maybe that could work if you do it simultaneously. If you cut back on everything, you're going to be miserable still. The methylene blue is probably not going to help combat all of those issues, but it would be definitely something that's going to potentially benefit long term. But there's so much more to methylene blue than just that.
Well, I mean, as we were describing earlier with the mitochondria,
Yeah.
Mitochondria per cell, we have tons of mitochondria per cell in our brain.
Yeah.
And our brain requires a huge amount of energy. It takes about 20% of the oxygen that we breathe, goes directly to the brain at any minute and any day of your life until you're not around any longer.
Right.
So the brain requires a huge amount of energy. And so one of the main places most people will feel mitochondrial dysfunction first is in their brain.
Makes sense.
Because we're using our brain all the time. I mean, there's been studies on master chess players who didn't move for an entire day burning 4,000 calories. That's all brain energy, right? So that's insane. A huge amount of energy. And so when you're thinking about methylene blue, the way I think about it, as I was describing earlier, is it's an energy enhancer and detoxifier at the same time. So it can help compensate for the problems that many of us have making energy. And then it also, but not only can it do that and help you make more energy, it also can help on the detox side as well. So most things that we take to increase our energy give us more stress on the system, like nicotine or caffeine, for example, which I have no problem with at low doses. But at high doses or even at low doses, some people can't tolerate them because it's increasing the amount of energy, but then you still have to deal with those waste products of energy metabolism.
Right.
With methylene blue, you're increasing the energy, but you're also increasing the detox at the same time. The key with methylene blue, though, in this case, especially, is to start off at low doses. So people talk about methylene blue and Adderall in the same conversation.
Yeah.
Some people will feel a stimulated kind of sensation on methylene blue itself, but most people don't. Most people just feel like their energy is just up and that they have like a sustained kind of elevation. It doesn't make you feel stimulated like caffeine and nicotine would, but it gives you this sustained elevation. Now, some people will tell you that they take methylene blue and they feel like they're on Adderall. Like it feels great. They have as much energy and good on those people. I'm not one of those people either, but what you find with most people is just this sustainability. Like, and if you're pretty well optimized, like you'll actually see this endurance wise, you'll see it with strength training at the same time. There's some evidence that you can actually put further out your lactate threshold. So you can actually reach failure later if you have methylene blue on board because it helps with the energy production side of things. Yeah. And so even if you're on an airplane and you're pressurizing so on an airplane, you're typically pressurized to about 6,000 or 8,000 feet above sea level. So you're low oxygen when you're on an airplane. Here in Colorado, it's not as much of a big deal for us because
we're kind of used to it.
And that's just why, I don't know about you, when I travel to places that are at sea level, I feel glorious when I get there. Yeah. My Oura ring is so happy with me compared to when I'm here.
I'm sure.
It's fine here, but it's like, holy, what did you just do? This is amazing.
Yeah.
I used to think about it like maybe just because I'm on my own for a couple of days and my kids aren't with me. And then I'm like, no, it's because I'm at sea level.
That's because, That's why. We go to Florida quite a bit because we have family, and it's always like, I feel so much better in Florida. And it almost gives you that, like, we need to move back here.
Yeah.
And it's like, no, I don't think that's it.
It's just because you're here.
It's just because I'm here. Because the minute I move here, I acclimate and then it all goes away.
Exactly.
And then I'm like, why the hell did I do that?
Exactly. Why are you back in Florida? Kind of
exactly.
Yeah. So, an airplane, for most people, they're hypoxic or relatively hypoxic. Yeah. And methylene blue can actually compensate for that low oxygen environment. Actually can work just like oxygen in your cells and help them make energy from what's called aerobic respiration for longer, even if there's not as much oxygen around. So it's actually great for altitude. It's great for climbing. It's great for mountaineering. And this is more anecdotal, but we have people that are using for Kilimanjaro, for Denali. I haven't had anybody on Everest yet, but I'm going to be going to Tibet in September.
Nice.
And be using it for that as well. I'm excited. But from like the big picture with methylene blue outside of performance is that mitochondrial support can go a long way. So if you need it in your brain fog can go away. Your moodiness or your lability, your change in how you feel can go and get more stable.
Yeah. And
there's also some capacity for methylene blue to increase some neurotransmitters like serotonin, dopamine, and norepinephrine. And so these can really, with that this mild elevation, can help you feel better too. And so it's not a lot and it's dose dependent, but 4, 8, 16 milligrams of methylene blue is most what people need to see a significant benefit. Now, and if you want to use stimulants on top of that, you can. So we have something at our company, Troscriptions. We have methylene blue with nicotine, caffeine, and CBD. So just low dose nicotine, 1 milligram, and caffeine 50, which is a quarter cup of coffee equivalent. Yep. So it's not a huge amount. And most people take half those doses and they see a massive benefit from a focused productivity. It feels like they're on a stimulant for about 3 to 5 hours without the come down and crash.
Yeah.
But the nice thing about it is that, yes, you feel that way, but you don't have that come down and that crash because you have the support of the methylene blue on board. So you don't have that stimulation without the detoxification.
Sure.
And so you have both when it comes to using methylene blue. And then CBD in that formula is also helping with that balancing of that stimulation with the support and increasing some neurotransmitters as well to help you make you feel, kind of blissful as well. That's what CBD does. It increases a neurotransmitter called anandamide, which is your bliss neurotransmitter. Ananda in Sanskrit is bliss. So
interesting.
Yeah. I don't know. Most people don't know that about CBD, but
no, I had no idea.
Yeah.
So is methylene blue for everyone?
What I often say to that question is that methylene blue can be for some people some of the time and other people for more of the time for some of the time, which basically says that I think everybody can benefit at some point. The question is how much, right? If you are somebody that's pretty well optimized, pretty healthy, good energy, then you may just need it when you're doing more stressful kinds of things.
Fair
like
enough.
you're
hiking or you're climbing Kilimanjaro.
Yes.
Yeah.
Hiking, flying, stressful at work, powering long days at work, that kind of thing.
Yep.
Whereas if you're coming in sicker, you've had complex medical illness for a while, you've had symptomatic brain fog or inflammation or pain, then you might have to take it for a longer period of time to see the benefit. But it's not like it, the main delineation I like to make there is it's not something that builds up in your body. It's something that when you find the right dose of it, that's when you know it's working. So it's not like, I'm going to start on 4 milligrams and stay there for a month and see how I do. No, it's like 4 milligrams. If you don't feel better in 3 to 5 days, increase it to 8. If you don't feel better in 3 to 5 days, increase it to 12.
Right.
And so that's what I typically do. So we have these things at Troscriptions called buccal troches or lozenges. And they're these cool little lozenges that's supposed to go between your upper cheek and gum and dissolve for about 15 to 30 minutes. And what's cool about them is that they're scored. So you can take a quarter of it, you can take a half, you can take a full, you can kind of find your dose. Buccal lozenges are great because they work faster this way, dissolved in here. And the ingredients are typically more bioavailable, which means that like when you swallow something, the liver tends to detoxify it, right? We talked about earlier. Mm-hmm. That being said, with methylene blue, it's actually 100% bioavailable, just about, whether you dissolve in the mouth or if you swallow it. So you can just swallow methylene blue and that's okay. If you have more mitochondrial support, more systemically, it's going to help you. However, if you have more cognitive issues, it might be better to dissolve it in the mouth because it's going to work faster, but your mouth will turn very blue because methylene blue is a very blue pigment, as many people know. Yeah. So short answer to your question is that I think everybody can benefit from methylene blue some of the time. Some people will benefit from it taking it more regularly, especially because they need more support. But the goal in my clinical practice and those kinds of people is let's get you on some methylene blue, these lower doses, and then slowly find the dose that's working for you. And then as we are doing that, we're optimizing your vitamins, minerals, nutrients, your gut, your cofactors, your hormones, and then we can slowly wean off the methylene blue over time. Yeah. There's also indications to use higher doses of methylene blue for like as an anti-infective, for example, or as a significant anti-inflammatory. So around 1 milligram per kilogram or above, which is about 50 to 70 milligrams for most people, maybe up to 80 to 100, depending on how big you are. That's an anti-infective dose. That's also an acute mitochondrial stress dose. So if I have people that are coming in that have acute viral syndromes, acute inflammation, I'll go up to those kinds of dosing in them and take it. I don't keep them on there for long typically, but I will keep them on there for shorter periods of time to help systemic inflammation or mitochondrial stress or infection.
Interesting. Yeah. Okay. From an inflammatory standpoint, what are your thoughts on like low dose naltrexone?
I think it's great. I use a lot of combination of methylene blue with LDN. I think it's a great combination of methylene blue in the morning and then LDN in the evenings.
Interesting. Yeah.
I also use, we have another product at Troscriptions called Tromune, which is the active component of the cordyceps mushroom called cordycepin. And it's about 100 times more potent as an anti-inflammatory, antiviral. And so I use that at night a lot in patients. And that's great as an
instead of the LDN?
In combination.
In combination.
Yeah, but the nice thing about the cordycepin, the Tromune, is that you can use it more acutely for people that are in a situation where they're going to get sick or a higher risk of getting sick, or when they're having immediate symptoms, you can start getting the cordycepin, the Tromune on board right away. And that can potentially help you with the aborting of getting sick or mitigate the symptoms. My kids at the house call it the green stuff because it's green colored, and they'll take it at night when they're not feeling well, and it also increases deep sleep. So what my anti-inflammatory stack for most people is going to be like Just Blue, which is our pure methylene blue low dose during the day. And then at night, LDN is a really common one that I use, along with the cordyceps and the tromium. So that's a very common one. But it's really important that, like, from an inflammatory perspective, you really gotta like take the fire and bring it down, right? And so that's often that sympathetic nervous system that we were talking about before. It's like that fight or flight that just won't shut off. And so if you don't deal with, the fire hose or whatever you want to call it, like the burning timbers, like everything else is going to only slightly get better. So, and so that's when really optimizing that sympathetic nervous system, that overdrive, is super, super helpful. And that's when I, really focus on that GABA system. So downregulating the anxiety, the stress, the nervous system dysregulation, that's going to be a huge help to decrease inflammation too. So like anti-inflammatory stack for me is, the mitochondrial support during the day with something like methylene blue. This is the immediate stack, methylene blue. And then I'll do the cordyceps and the tromium at night. LDN's a big one as well. And then I'll find ways to downregulate their nervous system using things that optimize the GABA system, magnesium, B6, glutamine that I talked about earlier, but also things that enhance GABA itself, which we can talk about. And at the same time, really trying to figure out why they're so sympathetically overrided. Is it because they're like me and they have 1,000 emails they wake up to every single day? Or is it somebody that has, a bad relationship that they need to get out of, or a trauma when they were a child, or a severe illness that required hospitalization that they need to address using psychosocial emotional care, and maybe something more significant, right? But that stuff takes more time, right? So my immediate stack is that methylene blue, the cordyceps, the LDN, the GABA, like that is a great way. Yeah. Okay. Then I can figure stuff out, just get but trying to get people to just like take down, go from like 11, to like 5.
Exactly.
It's the Spinal Tap analogy, which you probably haven't seen, but yeah, Spinal Tap's a great movie. Like, and turn it up to 11, and you've probably heard the line at least. Yeah. And they're coming out the new Spinal Tap, I've heard, actually.
Are they?
Yeah.
Just a remake?
Remake. Yeah.
Then I'll see that one.
I'm sure you will.
Yeah.
Just like you probably saw the remake of what's my Total Recall, right?
Oh yeah.
Yeah. So the original is so much better. So,
yeah.
Have you seen the original?
No.
See, damn.
I know.
See, I'm telling you.
I know.
I'm talking about these remakes. I was talking to a friend.
I'm watching both of them now, so
you have to.
I'm going to.
Total Recall is with Arnold Schwarzenegger is a must. But anyway, so that's my stack.
Okay.
When I'm starting to work with people right now, and then once I start like quelling the fire, then it's about trying to build them back up, right?
Sure.
Yeah.
Sure. So for to support the GABA, you said magnesium, B vitamins,
B6 specifically. Yeah.
Are those going to be specific to testing, like to the micronutrient and metabolite testing, or are those like across the board? You're going to increase B6, magnesium, and then the glutamine off the bat.
I think almost always off the bat, I'm doing that if I can. If I hypothetically love to get testing first before I do anything.
Sure.
You kind of see what their baseline is, but if I feel like I really got to do something now for them, it's those. It's vitamin B6 and magnesium, because those are cofactors, they're called, for an enzyme that converts something called glutamate in our brain, which is our primary excitatory neurotransmitter, to GABA in the brain. So it requires B6 and magnesium to do that. And so,
I got it. Okay.
And so many people most of the US population is also magnesium deficient. And so magnesium, most people can take it at night, increases your GABA system in various ways, as directly actually, and it desensitizes your glutamate system, which is the excitatory, but it also is that cofactor that's responsible for that conversion over into GABA. So magnesium has so many different roles in the body, and it's so important. So magnesium threonate is probably your highest bioavailability of magnesium in the brain. Glycinate's good too, malate's good, depending on the person.
Okay.
But citrate's more for pooping in the morning, that kind of thing.
Yeah.
So I
always love the people that come in and they're like, I'm taking this magnesium. And I'm like, you're taking the wrong magnesium.
Yeah.
You should have probably done the research. But yeah,
it's common. There's so many different types out there.
There are so many types.
And I personally have a hard time tolerating it. It makes either makes me have diarrhea or it makes me too tired. That I can't wake up in the morning. So like I'm always kind of balancing like how much I can take and doing these concoctions of magnesium.
Yeah, I've always avoided it at all costs. But the glycinate, I love the glycinate. That's what I typically take.
Gotcha. Yeah.
But
but otherwise on the GABA system, what I'm doing, what's really important for people to understand is that GABA as a compound, as a molecule, is too big to get into the brain. So if you take GABA as a supplement,
I was
it works
wondering
for
about
you, it means that you have a blood-brain barrier that's not doing what it's supposed to do.
Interesting.
It's a leaky brain. Yeah, so your
Interesting.
brain. So that's almost diagnostic in clinical settings. If you're taking GABA directly and it makes you feel tired, it's because your blood-brain barrier is not doing what it's
So
supposed
it
to do.
should not work.
It shouldn't work. No.
That is super interesting.
Except if you're taking super high doses of GABA.
Yeah.
And possibly like a nanoliposomal version. So if you're taking it from like a company like Quicksilver, for example, they have some evidence that it can get across because it's so small.
Okay.
But what's a good story is that I was just talking to a client of mine, and he initially was taking GABA and it was doing exactly what I just described, it making him quite tired and relaxed. And then we started getting him on his gut regimen, started taking more glutamine, and then all of a sudden the GABA doesn't work anymore. He takes it. Yeah. And so
and he's probably all pissed off. He's like, this
well, no,
doesn't work.
I told him it was going to happen, right?
Oh yeah.
And you know, and so that's important, right? And then and there's a couple other sort of nuances here from a clinical perspective that are important, but in essence, that's the biggest thing to tell people is like, if you're taking GABA and it works for you, if you have a leaky brain, most likely, you also have a leaky gut. So it goes back to what we were talking about before, right? You have to optimize gut function. You can do that in various ways, and there's lots of different ways to optimize the gut. We talked about a couple, but and so what I typically use, I use things that can optimize the GABA system that aren't GABA directly. So things like kava, CBD, CBG, and something called B3 GABA. Those are the 4 ingredients in something we have called TroCalm. TroCalm, those 4 ingredients, 3 of them work on the GABA receptor at a separate site, kava, CBD, and CBG, that increase the amount of GABA that binds. And then that 4th one, B3 GABA, is of a vitamin B3 attached to a GABA. And that B3 gets across into the brain that has its own transporter. Mm-hmm. And then you have B3 and GABA in the brain. B3 gives you mild activation because it works like NAD. It is NAD. And then you have GABA that binds to the GABA receptor where GABA would bind. And so you get this mild activation with the calm of being GABAergic, as we call it. And so you get this relaxation, anxiety mitigation without feeling sedated. And so that's really a nice combination. So you'll find your mind is quieter. So when your GABA system is dysregulated, your mind is going in a million different directions. We on average have 70,000 thoughts per day on average. I think I probably on average have probably like 90,000 thoughts per day.
I was thinking 100. That too. I was like, maybe more.
Yeah. So, but if you tend to be more anxious, and more stressed, more depressed, you can get to up to 120,000 thoughts per day.
Interesting.
And your GABA system helps regulate all that.
Okay.
And so once you start taking something that enhances the GABA system like TroCalm, you'll find that some of those obtrusive, perseverating thoughts, we call them, will just calm themselves down. In fact, I was just getting a message from somebody, one of my clients, just a minute ago before we started recording. This amount of TroCalm relaxes me just a little bit. This amount turns my thoughts off. Like this amount actually makes me want to go to bed. And so like you can find out where your dose is when you titrate these kinds of things.
Interesting.
Yeah. And then we have something called Tro-Z, which has something called hanokiol from magnolia bark, which is working on the GABA system. And another cool compound called agarine, which is a long-acting molecule that's from a psychedelic mushroom called the Amanita mushroom, the Amanita muscaria, which is the red mushroom with white dots, psychedelic mushroom at high doses. At low doses, a particular ingredient called agarine is long-acting and binds to the GABA receptor where GABA would bind, and then gives you that gives you the sedation as well. So that's why it's better to take it at night.
And would you take those two in conjunction, or
you can? But typically, people take TroCalm like during the day because it doesn't make you feel sedated typically.
Gotcha.
And then you take the Tro-Z.
Got it.
We have something called Tro plus Somna, which is for practitioners. That's higher strength agarine. Also with something called apigenin, which is another GABA.
Yeah.
And then DHHB, which is a higher strength magnolia bark, hanokiol. You take those at night because the agarine's long acting.
Yeah.
And it's going to stay on the GABA receptor for longer. So the idea is if you have those middle of the night wake ups, you feel like you're like looking at the ceiling, like hopefully with the Tro-Z, the agarine on board, you can go back to bed because you're not so super awake, as a result. But some people use the TroCalm for bed. Actually, that's what I do because once I get to bed, I'm good. I'll sleep from all the years of being woken up at the hospital.
Yeah.
But it's that initially falling asleep can be hard sometimes. Yeah. And so the TroCalm is great for that because it just makes you feel
just turns everything off
down. It just turns down the volume,
So TroCalm during the day. That's interesting.
Yeah.
Because I'm sure you're probably able to focus more because you don't have those obtrusive thoughts.
You said it perfectly, right? So like if
because I would think normally I'm like, that would be terrible. I want all my thoughts, right? But yeah, I mean, go ahead.
Right.
Yeah.
No, you're saying it right. So the great example of this is everybody's had this dream in some capacity, right? You're about to give a big speech, or you're about to do something big and you forget what you're going to say, right? You just forget all your lines, whatever it might be. This is because your brain is so sympathetically dominant that actually the amount of blood flow that's going to the front of your brain has actually gone down because of constriction. And so if you can just down regulate or decrease that, the valence, the amount of stress, the amount of sympathetic fight or flight that's active, and just bring it down just a little bit, your brain's going to turn back online. And all of a sudden it's like, oh, I can flow in here, right? So we talk about it, from the boardroom to the bedroom kind of thing. Like, because if you're in the boardroom, you downregulate your nervous system a little bit, you're going to perform better, right? Before bed, same kind of thing. And also there is the performance anxiety aspect of things for males in the bedroom as well, because we know that an erection is parasympathetic. So that requires you to be relaxed, but sympathetic is ejaculation. So if you can maintain yourself at parasympathetic for longer, it might make your spouse or partner a little bit happier as well.
That's fair.
So we have people that we use it specifically for that reason.
And there's probably an erectile dysfunction component to that as well, with the psychological aspect.
For sure, yeah. So one of the major reasons why people can't, get erections is because of sympathetic overdrive. Like they're too hyper stressed, they cannot get an erection.
Exactly.
Right? And so that's downregulating your nervous system is going to help you get a better erection as a result of that too.
That's super interesting.
Yeah.
Because then that's, again, going back to the Band-Aid thing. I mean, tadalafil and sildenafil are so prevalent nowadays in helping people that, we have people come in and they'll come in at, 50 milligrams to start on the sildenafil, and then they'll have to go up to 100 because it's habit forming. So eventually they're up to this maximum dose,
right? And
it's not working anymore. And it's like, at some point in time, you want to be like, I think it's a cognitive issue. I don't know. I mean, it could be a blood flow issue, obviously. There's definitely that. But most of the guys that we see, especially younger guys, it's like, I don't think that there's anything wrong with you.
No,
I think it's probably a sympathetic.
It's a sympathetic overdrive thing. Yeah. Once they can downregulate that,
Yeah.
You know, everybody's hard charging and just wants things to help them.
That's super
easy.
interesting.
I mean, there's some interesting things with tadalafil and vardenafil when it comes to anti-aging and blood flow. And
I love tadalafil in low doses.
Yeah. What are you using? Like 5 milligrams?
5 milligrams. Yep.
Yeah.
Yep.
And I think that's a really good dose for most, from like a longevity. I mean, there's some really interesting studies, right? Like men who took Viagra had 50% less chance of dementia.
Yeah.
You know, it's like
crazy.
Whoa. Right. Yeah. And then from a blood flow perspective, brain flow. So I think that there's some pretty compelling research there.
Absolutely.
But from a erectile dysfunction perspective, it shouldn't be. And then one thing that's important with those PDE5 things is that it doesn't increase the amount of nitric oxide. It just prevents it from breaking down. So you still need nitric oxide around to be able to actually see the benefit of using those. Mm-hmm. So if your diet sucks, if you're smoking or something like that, like you're not gonna have enough nitric oxide around to even have enough to stick around longer to maintain erections and things like that.
Sure.
So I learned that from a nitric oxide expert. So it's important to people know that like it's not giving you more nitric oxide, it's just having it stick around for longer. So it's an important point.
Interesting.
Yeah.
Interesting. Okay.
Yeah.
I lost my train of thought as to what I wanted to go on to next.
Oh, it's okay. I mean, I think there's a lot of longevity drugs that are out there.
So many.
But I think the context is just important, right? Which is that if you just use tadalafil without optimizing mitochondrial function, probably like it's pissing in the wind, right? The same thing comes with everything else. So it's like a matter of, looking at things in a bigger, more integrative, more holistic way.
I remember what it was. NAD in conjunction with methylene blue.
Yeah.
I've heard it's a no-go.
Oh yeah,
you're not supposed to do it. I don't know. One of my providers was like, hey, so apparently like NAD is kind of like contraindicated when you're taking methylene blue. And I was like, I've never heard that. I'm like, show me the research, I guess, on it. And
there isn't any. I mean, I think that what it comes down to here, I think it's like a bigger conversation about NAD. I think that the longevity space has been enamored by this particular molecule now for the last, 5 or so years, maybe longer.
Yep.
But there's some evidence really that it's probably not the right thing to be doing for most people. I mean, giving precursors is probably a good idea, but NAD itself and IVs, there's really no indication that NAD IVs even get to the brain. Like there's really no indication, right? So it's a question of also understanding that NAD is also very important at high doses for cancer growth as well and cardiac problems. And so I have a friend of mine, her name is Dr. Elizabeth Yurth. She's actually here in Boulder. I did a podcast with her on ours, and we talked about some of the dangers of potentially taking NAD.
So NAD will actually increase the growth of cancer cells?
It can, yeah. And so if you're taking NAD, you're supposed to be also taking another enzyme that helps break it down called 1-MNA.
Yeah.
And so like, there's also a company that makes that particular compound. So anyway, but from like the perspective of methylene blue, my sense is that what methylene blue can do is help make more efficient your electron transport chain in the mitochondria. And one of the things that becomes less efficient in many people is that first complex, which actually recycles your NAD. And so what methylene blue can do, I think, especially if you have a complex that's not working very well, is that NAD that's coming in is helping it recycle better so that it can continue to help you make more energy. So I don't see a contraindication. I don't see a reason why you wouldn't take it. I can only see it as an enhancement kind of thing.
Yeah. But you're saying that NAD might not be
I don't think NAD is
ideal for everyone.
I don't think it's really
potentially
good.
anyone.
I think short term for some people might be okay, but I think long term probably not. I think, taking vitamin B3 and optimizing your, B3 status is important. And I think everybody should do that. Mm-hmm. But I don't necessarily think that taking NAD is a good idea for most people. Even NMN or whatever it is, like NMN and what's the other one? There's the other form of it that I'm forgetting. But those might be okay. At least they're precursors and they're not, NAD itself, so the body can sort of regulate itself.
Sure.
You just have to remember there's all these sort of downstream and upstream and feedback pathways that are always happening in the brain and the body that you have to just be aware of. And the one that you have to be careful with NAD is cancer growth.
That's super interesting.
Yeah. I remember taking I get an NAD shot. I felt like $1 million. Yeah. I remember feeling like, this is probably 7 or 8 years ago now.
Yeah. Yeah. Because we're doing more injection than infusions because the infusions just take too long.
They do take a long time. So I think there's probably a role for them in the short term.
Yeah.
But I think long term, it's like, okay, what are we putting a Band-Aid on, And what are we doing here to really support the system long term? Right.
Interesting.
So, yeah.
Okay. Well, that's really good to know. What else do you have? Anything?
We could keep talking.
We could go for forever. Where are we at?
Hour 6.
I think we're good.
Yeah, that's about it. I think that's a good. An hour is good.
I would love to talk to you more. For sure.
Sure. Yeah. Happy to. Yeah. Well, thanks for having me, man. This has been fun. It's nice to have, you local.
Yes.
And as you said before we started recording, it's a great way to meet new people and
100%.
And I'm happy to do it too. That's why when y'all asked if I could be on, I said, if I can come to Boulder, I can hang out with people that are in the space, I think it's great. So,
no, I really appreciate it, man.
Yeah.
Seriously.
Yeah, it's my pleasure. Yeah. So I would just maybe finish off. People are interested in more about what I'm doing. They can go to my personal website. It's drscottsherr.com, DRSCOTTSHERR.com. That'll give you my consulting for hyperbarics, for my health optimization practice, also my companies, Troscriptions, One Base Health. And you can go to those sites directly, Troscriptions.com, OneBaseHealth.com. Our nonprofit is homehope.org. So if you're a practitioner, you're listening, you can check it out. If you want training, you don't have to be a doctor. You don't have to be licensed. You can just have to be somebody that's interested in health and work with clients in various ways. So you can get trained, if you're interested, right?
Yeah.
And also on Instagram at Troscriptions, at Dr. Scott Sherr.
And Troscriptions, patients, anyone can order.
Yeah,
right?
yeah. We have most of our products are available to everybody.
Okay.
We have some products that are just available to practitioner clinics, like your clinic, for example, could purchase our practitioner only products as well, and have those in stock. But for most people, it's going to be easy to get most of our products right now.
Okay.
So we have our Just Blue we talked about. We have something called Blue Carnitine, which is our methylene blue with nicotine, caffeine, and CBD. That's our focus. Trocom, Troz, Tromune. Those are the ones we chatted about today. So
got it.
Yeah.
Awesome. I appreciate it.
My pleasure, man. Thank you for having me.
Thank you.
All right.